Namaste, I'm Dr. Siri. Fibroids are basically non-cancerous tumors which grow in the uterus, which is mostly seen in women of reproductive age group. The fibroids prevalence is quite wide, like 25% to almost 50%. It varies from place to place and race. Different human race are, the incidence is different. And also it is seen that the rural women, the fibroids are seen higher. And also with advanced age, the fibroids are seen to be more prevalent. The patients with fibroids may be absolutely asymptomatic. They may just come and a routine ultrasound may detect a fibroid. So we generally don't do anything about such fibroids which are not causing any sort of symptoms. But otherwise, they may present to us with pain during period or excessive bleeding or irregular cycle, intermenstrual bleeding, or even they may come with infertility because of the fibroids. And sometimes they can cause pressure symptoms like an urgency to pass urine or pain while passing motions. They can present like that also. And sometimes the fibroids, they might come with pregnancy complications also. Again, the fibroids may be located in different places of the uterus. Depending on that, their effect on fertility will be assessed. So if the fibroids are more on the surface of the uterus, then they will in no way intervene with the fertility unless they are very huge. Otherwise, fibroids can be in the muscle layer of the uterus, which could be interfering with the fertility. So if the size of that fibroid is more than 4 centimeter, then we will consider surgery because it could be distorting the anatomy or the structure of the uterus and hence affecting the pregnancy also. And also the location where it is located. If it is located close to the fallopian tube openings, then it could distort the opening anatomy of the uterus. And all the fibroids which are grown or projecting into the uterine cavity is what we have to treat and remove it surgically, because that will directly be affecting the implantation site of the embryo which comes into the uterus. So, and also because of these fibroids, there can be repeated abortions also. I've already explained about it. All fibroids don't need surgery. Only those which cause symptoms need surgery, or if they are very huge in size. See, up to 3 centimeters or 3 to 4 centimeters, if they are not causing anything, we don't do any surgeries or intervention. But if they are more than 5 centimeters and depending upon the symptoms and location, we would suggest a treatment. But definitely the larger fibroids which are more than 7 to 8 centimeters need surgery because they causing pressure symptoms or turning into cancerous changes, bring about cancerous changes are higher. So a bigger fibroids definitely need surgery. The treatments are again depending upon what complaints the patient has come, the size of the fibroid. So if they are very small fibroids and if the lady is approaching her menopausal years, then we would prefer to give medicines or tablets, oral tablets, to just reduce the size, to just push on for probably another 3-4 years, since it is not causing a huge problem to the lady. But if there is a huge fibroid which is causing a lot of pain during her period and a lot of bleeding during her periods, then definitely it would need surgeries. Surgeries, again, there are minimally invasive surgeries which are called as laparoscopic surgeries, and there is robotic surgeries which will help to do the surgery faster and the recovery is much faster for the patient. And there are some non-surgical methods also, but they are to be used for a very limited population where fertility probably is not needed. In those cases, there are some non-surgical methods of treating the fibroids also. Fibroids, when we do a surgery, we are more aiming at removing only the fibroids and leave with the uterus. Again, it depends upon the number of fibroids, the size of the fibroid, and also the age of the patient. If the patient's age is 45 years and above and have multiple fibroids, we would suggest doing a hysterectomy, which means removal of the uterus along with the fibroids. But if there is only 1 or 2 fibroids which are big, then our aim is to remove only the fibroids and preserve the uterus. It so happens, since fibroid is a very slow growing tumor, sometimes when a surgery done early in the reproductive age group, so maybe around 30 years or so, she still has another 20 years of her reproductive cycles. So there might be small fibroids which were not visible then, which could grow and be evident or more visible during the later part of her reproductive age, like around 40-45 years. The smaller fibroids could grow up to become more visible at that age.